Now, can you speak a little bit more, a little bit more about these formulas? And when did you develop these formulas? How long did it take? What exactly, if somebody starts taking these formulas, how are these products going to help them? Differently than maybe some of these other products on the market?
Well, I'll have to do some doctor lingo here, but I'll keep it kind of down to everybody who's right with me. Of course, a lot of the addicts know quite a bit about the neuropharmacology involved. Well, basically speaking, I look at addictive behaviors and substances in two major groups: stimulants, downers, and pain pills, okay? Or stimulants and analgesics. Let's look at the stimulants.
Now, what exactly is an analgesic?
Pain medication.
Okay.
Sedative hypnotic would be a downer like a Xanax, but we're going to look right now at Addiction Buster 1, what it does.
Okay.
And what it's looking at and what it's treating. Two big divisions. We're looking at Division 1, Addiction Buster 1. Why and what it's treating. Addiction Buster 1 is tailor-made to treat addictive chemical substances like nicotine, crack, meth, Adderall, any stimulating kind of drug, okay? Within this, I'm also looking at marijuana because it has a excitatory effect, PCP, LSD, stimulating drugs, okay? And also the stimulating behaviors, compulsive gambling, pathological gambling, internet addiction, hoarding, eating disorders, nicotine, these things. That's a whole class. Now that you're back to the altered electrical and chemical balance in the brain. And also when we're addressing addictions, we have to treat the entire components of it. That's a distorted problems in the medial forebrain bundle of the brain, the forebrain where you have the dopaminergic reward system. And also you're going to have distortion of neurotransmitters, receptor sites, and hormones. And also you're going to have to address the destabilized membranes that are responsible for withdrawal. So Addiction Buster 1 has, and all these components are in a specific ratio proportion to maximize the effectiveness. We have Mucuna Pro-Uens, increases dopamine, just like the stimulating drugs and addictive behaviors do, but it doesn't increase it in an addictive fashion. It provides a slow increase in dopamine to help with the ahedonic mood or the down mood. And then we have an acetylcysteine and magnesium citrate, and these two components normalize extracellular glutamate and also downregulate catecholamines. So it kind of just helps with the whole reward system area with stimulating drugs and behavior. And then the Craving Aid comes in, and the person takes the Craving Aid along with Addiction Buster 1 to help with the short and long-term cravings. And the Craving Aid contains B6 and L-glutamine in specific ratios to increase the brain's natural tranquilizers to help with cravings. Now let's take a look at Addiction Buster 2 and how it works is really cool as well. When you're looking at the second group of addictive behaviors, you're looking at the sedatives, hypnotics, and the analgesics. Both of these specific classes of drugs like downregulate certain mood areas with regards to specific neurotransmitters, and they have a downer effect, really downregulating the brain along with an analgesic where they're occupying endogenous receptor sites, okay? So this broad class of drugs works this way to create its addiction along with pornographic addictions. Here we've got Kava. Kava is a really neat herbal formulation that has an analgesic effect. It activates the brain's own natural benzodiazepine receptor sites, and it also inhibits monoamino acid oxidase that increases a lot of neurotransmitters that are really adversely affected by these class of drugs. And then once again, we add an acetylcysteine and the magnesium citrate for the previous reasons I explained, which normalizes extracellular glutamate, downregulates catecholamines. The whole synergism of this combination, which is in specific proportions, treats the addictive component of this drug class. Once again, we're going to use the Craving Aid with this Addiction Buster 2 as well for the short and long-term cravings. These combinations are effective, they work, they're non-addictive, they're natural, And you don't need a prescription to get it. You can get these compound. You can use these things in the privacy of your home. This really empowers the addict or the alcoholic. And it lets them put the recovery activity in their court. Nobody has to find out about it. You don't have to tell your insurance carrier. You're not going to lose your job or be, treated like some sort of a zombie because you're trying to get help. It personalizes, and we're certainly going to tell everybody. It puts the addict or the alcoholic in the driver's seat, or that person who's addicted to pornography or compulsive spending. They've got problems too. They need help.